Well, supposedly we're live, but I will go to Instagram here and click go live again. There we are. So we're back this week. Last week, we Jessica is very private, and so she will talk about what happened last week. But as you can read in the heading, we are post-op, and I will let her tell you about her experience from here. And she's going to talk about all kinds of things. She's still a little sore, but I'll let her explain.
Well, what is it? A 3-year journey?
Oh,
At
God.
least
Yeah.
of something wrong, but not sure what. And then just chasing through all the specialists like everybody else does. Just honestly, we started out just to see what somebody else would say, and then just kept going. Anyway, I had a L5S1 fusion, spinal fusion, and in hopes that would take care of the numbness and tingling in my right leg, which just happened to start after a COVID vaccine, which probably from inflammation. But I ended up having a ruptured disc or a bulging disc, or
I bet you we get flagged for you saying that. We'll see.
it's my story.
Go ahead.
I'm just sharing my story. I'm lost track of thought.
So you got the shot. Your foot went numb. Your leg went numb.
So anyway, then it was just inability to lose weight, lymph issues, and then I guess we thought about it for a little bit. About I had a traumatic C-section about 12 years ago, 13 almost, and so I had a phalansteal incision, and it was scarred. So I had a lot of scar massage revision, which helped with lymph drainage. But I thought we had worked through that. Apparently we did not, because my bladder had adhered itself to the abdominal wall. And so as they were cutting through the old scar to gain access to my spine, we went through my bladder. So I was the not so proud owner of a catheter bag for the last week, although I always wanted to pee standing up, but that got old real fast. So anyway, that's what I had done. So now I'm just going through the healing process, which I don't pee standing up anymore as of today. The bladder was cool and was good. But however, I took that as a blessing, because I have said now for at least a year and a half, which I thought maybe was a tumor, because I love to garden, I love to do things, and I would just have immense cramping and pain. And I'd always say, I feel like I got a water balloon right there in my left side, which apparently was my bladder. But none of the MRIs or any of the other things had ever caught it. So it is no longer that way, and we will get right on massage therapy to help reduce that scar and have it scar someplace it should have scarred it.
Well, and you've moved immediately. I mean, you.
Oh yeah. So I was all about going home that day, and I did choose. I chose to stay for them because they said I had to, but I was gone the next day, and I walked as quick as the PT got there. So we walked, and I did stairs, and came home. And I for the most part did what I was supposed to do. It was super painful, actually worse than childbirth, but not as bad as the dislocated elbow. But we took the catheter bag for a walk every day, and so we're on day 7, no 6.
This is actually a week. Today is Tuesday, so
Is
you're
today
1
Tuesday?
week. Yeah.
Okay, sorry.
You had it done last
day.
Tuesday.
So today is a week. So catheters out. I can get up and down by myself, which I could do about day 3.
Yeah.
anyway, it's been an experience. It's very humbling. And you guys should want to take care of yourself because you don't want to own one of those things. And I think that I bounced back pretty quick. So, as far as like my back does not hurt, my back feels great. I have great sensation in my feet. The tingling and the numbness is mostly gone. No radiating pain through my hips. My stomach, even though it's tender and sore, inside feels amazing. Like I can know I noticed. I'm pretty sure that I was strangling my lymph system and having all kinds of chronic pain issues that I didn't even realize that hurt. So I knew it hurt bad enough that I wasn't going to ride my bicycle anymore, but I didn't realize how bad it hurt until it didn't hurt
Well,
like that anymore.
that's actually what drove you to it,
Yeah,
because
I wanted to ride the bicycle again. So we were as
you
on
kept losing mobility.
yeah, on our best weeks we would ride about 150 miles, but still couldn't lose weight, but I was losing strength and it was biting me. And so I think the bicycle was the main driver of wanting to just think about the surgery. And then I started getting weakness, so I would go down the steps and the leg would give out, and I'm too young for that, and I got things to do and places to go. So I was sold on the surgery. I had a fabulous team, and they felt terrible that they ended up in my bladder and not where they were supposed to be. I took it as it's all blessings for me, but it makes me super sad as somebody from the medical field that we have excellent, excellent physicians, surgeons, anesthesiologists, MDs, however many practices there are, that they're talented and want to do their best, but are fearful of what's going to happen if something goes wrong. So complications happen every day, accidents happen. I don't even look at. I'm thankful. I'm so thankful that it happened and they've repaired it. Um, but it's just sad to think that a lot of physicians leave because of the way we treat them for them trying to help us. So
Well, and so yes, it was a complication. The surgery went an extra hour or so long because they did dissect the bladder and they went through it. But instead of getting mad, couple things. One is she takes really good care of herself. And the doctors even said, man, inside she looks great. What the discs above and below where the trauma was looks great. So she has taken very good care of herself. She walks the walk and she has recovered. I mean, they were pretty amazed at how fast you have bounced back.
oh yeah, they don't think I'll have any issues. So um, I mean I've been off the floor for a while, but you know I think our with the experience leading up, and when you tell people who you're going to, in the I would never go to see that person, and that makes me really sad too, because a lot of our ability to heal is not from the physician, it is from ourselves. So all surgeons and doctors will have good stories and bad stories, but I think they get it a lot of, in my opinion, that is wrong, because there are fabulous surgeons that are excellent at what they do, and I believe that almost all of anybody that goes into healthcare, I believe, goes in for the greater good, wanting to help people. So nobody intentionally, unless they're psychos, want to hurt anybody. But what was I talking about? Pain medicine is no good. Don't do drugs.
She's kind of funny when she's on pain medicine. But regardless, the takeaway from this,
Oh yeah,
we feel really bad for the general.
I got my track back. It's so a lot of your experience a lot of time is based on you and what you do for you, not necessarily the talent of a surgeon. Like, there can be people that have great results and there might be somebody that doesn't, but I believe the surgeon is always going to give their best. It's what they're working with. So what you put into your body matters, what you do to your body matters, and how you treat your body afterward matters. So if you lay in a bed and don't move, take pain medicine, and eat garbage, I don't know that you could expect a wonderful result. Guess that was my train of thought.
Yep. And along that train of thought, she didn't go in there with a pristine body. We have multiple car accidents. She is a lover of horses. Why, I don't know, but hey, that's her gig, not mine. She's fallen off the daggone things. They've thrown her.
Well,
injury after injury.
The poor little nurses, and they were like, wow, you've just had a traumatic life, which I thought was really an odd way to put it, because I've had some really traumatic experiences, and looking back, I would never say that they were
a traumatic.
I don't look at them as traumatic anymore. I was like, I just giggled. I was like, well, I don't really look at it like that. I look at it as I've had a full life and I'm very adventurous. So I guess I got to try everything out once. Although I never want to have to pee standing up again. But
I bet you'd take pee standing up over dislocated elbow.
Absolutely. That was probably the worst pain. I really needed that anesthesiologist on day 3 because I was like, it was worse than childbirth. But that's why I only have 2 children.
But long story short, if she didn't do the things that she had done in the past, then she probably wouldn't have gotten the results. And that's with anybody. Plus, it's her outlook. That's the other thing. The outlook on life, on situations, bad stuff is going to happen. It's how you respond to that. She doesn't view herself as a victim. She's like, hey, and what she didn't tell you is riding the bike, she would have left lower quadrant pain. And she would say, it just feels like it's full. It's stabbing me, and we would palpate and we would take x-rays, and she's had MRIs and nothing really showed up. But when we talked to the surgeon was like, super apologetic for really no reason, because one way or the other, he was going to have to do that. Even if he cut into it and then all of a sudden, lo and behold, here's the cocooned bladder.
Well, and I'm aware
got to release it.
Yeah, everybody's made aware of the risks prior to surgery. Surgery comes with complications and risks sometimes. Not every one of them is going to be perfect. So there really was no apology needed. I took it as a blessing, honestly.
Yep. And that's the way when he was talking to me, I was like, well, if that was the case, that was going to have to be released anyway, because we couldn't do it manually. I've adjusted her. I've done lots of stuff, acupuncture. She's been to see massage therapists,
myofascial release people.
Oh yeah. She would come out of there black and blue, and we were not going to reverse that. And it's like she said, it's a blessing. He got in there and he's like, I had to release the bladder because it was literally cocooned in there. So it is how you look at it. And it's also how you think about it. So we are post-op and she's doing very well, which we're very pleased with. I'm glad that I'm so glad she came out of that okay. I was worried. It took about an hour longer, and I was like, this was only scheduled for an hour and a half. Why are we going long? And then once that they got in there and they did what they had to do, and that was a good thing. So with all of that being said, she's healthy. She's doing well. She's up and about. Go ahead.
Yeah, and I'm going to say, like, if you listen to your body, it will tell you there's something wrong. It was interesting how, like, it was pinpointed, and how I expressed it to my primary care is I feel like I have a water balloon there, And so my fear was it was a tumor. I think I've seen every specialist, and I know every cyst, hemangioma, and every little defect in my insides, but that didn't show up. But funny thing is the bladder is kind of like a water balloon, and it was absolutely seized that to that area. So, you know, learn to listen to how your body feels and what it's trying to share with you, because if you really listen to it, then and know yourself, then you'll know something's wrong and don't give up. So this has been 3 years, like umpteen appointments with every specialist under the sun. But and a lot of them didn't listen, including my primary care at first. But be adamant, understand who you are, what you are, and know the truth about what you're putting in and what you're doing to yourself, because it truly is a choice of what you do. But you're gonna get physicians that maybe don't hear you or question you. Just keep on searching to find the answers, because they're out there and you will absolutely find them. So I think this was, I mean, I'm wonderful with sleep and really with movement, even with everything that I couldn't do anymore, which was sad for me because I had to give it up because it was so painful. But I was still line dancing and ballroom dancing and walking, and so I was getting plenty of movement still. My nutrition, of course, I treat myself every once in a while to what I would like, but I mean, it's never really bad, but pretty on point. My supplements, I didn't take any pain medicines. I really didn't
no
take
medication.
Yeah, I don't take any medication.
We have 80 pages of testing that we have done personally that shows that physiologically there is no reason for her to have this pain. And we have done everything, and food sensitivity and blah, blah, blah.
Well, and even though it hurts, like it's a different kind of hurt. Like it immediately feels different. So I'm pretty for certain in 2 weeks, I'm going to feel fabulous. I really hope
and your doctors say that.
Yeah, I really hope that my lymph system starts draining properly. Just, I guess if I'm going to share anything about it, just understand who you are, listen to your body, and don't over medicate it so that it doesn't talk or you can't understand it anymore. But just keep searching for the answers. Like if your MD doesn't listen, we're available. Contact us, because eventually you will find your answer and figure out the root cause of the issue. So I needed a little more help than what we could do. I got rid of that disc. I'm about a 1/2 inch to 3/4 inch taller. I got my height back, and I feel really good, even with post-op issues. But I feel different, and I feel really good, and I am going to be back on my bicycle in about 6 weeks.
So thank you for listening to us. And for those of you that knew, thank you for your prayers and thoughts, and have a good night.